Hello doctors, this is Dr. Hira Salman. So welcome back to MCQ of the day from AMBUS. And today we are going to solve one question from General Principles. So let's get started. Okay, so the question says, a 68-year-old man comes to the physician in July for a routine health maintenance examination. He is a retired teacher and lives in a retirement community. He has hypercholesterolemia, hypertension, and osteoarthritis of the left knee. Last year, he was diagnosed with a chronic lymphocytic leukemia. A colonoscopy 8 years ago was normal. The patient had a normal digital examination and a normal prostate specific antigen level 8 months ago. The patient has never smoked, and does not drink alcohol. Current medications include aspirin, lisinopril, simvastatin, chlorambucil, rituximab, and a multivitamin. His last immunizations were at a health maintenance examination 7 years ago. His temperature is 37, pulse is 82, respirations are 14, and blood pressure is 133/85. Examination shows a grade 2/6 systolic ejection murmur along the upper right sternal border and painless cervical lymphadenopathy. Which of the following health maintenance recommendations is most appropriate at this visit? So he is 68 years old. He visited in the month of July. He is having hypercholesterolemia, hypertension, osteoarthritis, and he is a diagnosed case of CLL, chronic lymphocytic leukemia, and he was diagnosed last year. Colonoscopy was already done 8 years ago. The patient PSA level was done 8 months back, which was normal. The patient is a non-smoker. He is on chemotherapeutic agents plus aspirin, lisinopril, and simvastatin. And his last immunizations were at a health maintenance 7 years ago. 7 years ago, and he was diagnosed last year with CLL. It means that there is no immunization history after being diagnosed as a CLL patient. Okay, so which of the following health maintenance recommendation is most appropriate at this visit? So at this visit, what you're going to do? Are you going to give him pneumococcal conjugate vaccine, or you are going to offer colonoscopy, or you're going to do abdominal ultrasound, or you're going to perform low-dose CT scan of the chest, or you will give him meningococcal conjugate vaccine, you will advise prostate-specific antigen test, you will advise for varicella vaccine, or you will give pneumococcal conjugate vaccine 13 and PPCV 23, or you are going to give him only this PPCV 23, or you're going to give him influenza vaccine. So what do you think? What you're going to do? He is a diagnosed case of CLL. It means that he is immunocompromised, being on chemotherapeutic agent. So let's see, one by one, we are going to rule out. Okay. So first of all, let's see the important points key info here. His age is very important, that is 68 years old. He's having CLL, colonoscopy was done 8 years ago, PSA normal 8 months back, last immunization at a health maintenance 7 years ago, and at this visit, what you're going to do. So this patient history of CLL and chemotherapy, that is he's on chlorambucil and rituximab, are risk factors for immunosuppression. So we are going to give him this pneumococcal conjugate vaccine, that is PCV13. Why? Because this PCV13 offers protection against 13 subtypes of Streptococcus pneumoniae and related diseases. PCV13 is currently recommended for all individuals more than 65 years of age with an immunocompromising condition, like in this patient who is having CLL or who is on chemotherapy, and should be followed by this PPSV23. So first you're going to give him PCV13 and then followed by PPSV23, that is pneumococcal polysaccharide vaccine, at least 8 weeks later. 8 weeks later, not at the same time. If the patient is 65 years of age and he is healthy, then you can offer him this PPSV23 initially before PCV13. But if the patient is 65 years or maybe more than that, so and he's not healthy, like in this patient, you cannot offer him this PPSV23 initially. You have to give PCV13 first, and then after 8 weeks you can advise this PPSV23. Now, since this patient last immunization was 7 years ago and prior to his diagnosis of CLL, he requires vaccination with PCV13 at this visit. Other indications for PCV13 vaccination include if there is a history of CSF leaks or cochlear implants or asplenia, or if it's a case of sickle cell disease, the patient is HIV positive, he's having CRF, if there is any history of metastasis or solid organ transplant. These are all the patients which are immunocompromised. So you have to give PCV, that is pneumococcal conjugate vaccine 13 in these patients. What about colonoscopy? Colonoscopy, according to US Preventive Services Task Force, screening for colorectal cancer should begin at age 50, continue until age 75, but colonoscopy is recommended every 10 years. And his colonoscopy was already done 8 years back, and that was normal. So there is no point for means right now. Yes, but if the patient is having some symptoms of colorectal cancer, maybe if the patient is having weight loss, a history of weight loss, or if there's any GI bleeding, or there is any suspicious of abdominal mass. So these are the conditions where you can think of colorectal cancer. In that case, you can advise colonoscopy. But here in this patient, there is nothing like that. So we will wait for 2 more years for colonoscopy. Now, what about abdominal ultrasound? Abdominal ultrasound can be used to screen for abdominal aortic aneurysm, but only in high-risk individuals. Again, the US Preventive Services Task Force recommends one-time screening for abdominal aortic aneurysm with ultrasound in men ages 65 to 75 years of age who have history of smoking, which is not in the case in this patient. This patient has never smoked. Now, what about low-dose CT scan of the chest? Low-dose CT scan of the chest can be used to screen for lung cancer, again in high-risk individuals. The US Preventive Services Task Force recommends annual screening for lung cancer with low-dose CT in adults 55 to 80 years of age who have a 30-year smoking history and currently smoke or have quit within the past 15 years. But as our patient is a non-smoker, we will not go for low-dose CT scan of the chest. So this man has never smoked and therefore does not need a low-dose CT scan. What about meningococcal conjugate vaccine? Meningococcal conjugate vaccine is effective against different serotypes of Neisseria meningitidis and is recommended for all adolescents susceptible to Neisseria infections. Say, for example, patients who are having complement deficiency or who are having functional or inanimate asplenia, and those who are HIV positive. So these are the conditions where you will offer this meningococcal conjugate vaccine. But this man in this question has no risk factors that require he receive the meningococcal vaccine at this visit. So we will not offer this vaccine. What about prostate-specific antigen? Again, the US Preventive Services Task Force currently recommends that the decision to use PSA screening for men aged 55 to 69 be made on individualized basis. Clinicians should discuss the potential benefit and harms of screening with patients. However, in this case, the patient has had a normal PSA concentration 8 months ago. PSA was already done and it was normal and therefore does not need to be retested at this time. So we'll not go for that. What about varicella vaccine? The varicella vaccine is a live attenuated vaccine recommended for children to protect them against chickenpox. But for children, this man no longer requires the varicella vaccine. He is 68 years old. So we will not offer varicella vaccine in this case. But he should receive the Zooster vaccine if he has not yet had it. Currently, the CDC recommends that recombinant Zooster vaccine rather than the live Zooster vaccine for the prevention of herpes zoster, that is shingles, and the recombinant shingle vaccine administered in 2 doses, 2 to 6 months apart, is recommended for immunocompetent adults who's more than 50 years of age, regardless of a history of shingles. So if there is an option of Zooster vaccine here, we will go for that, but not for the varicella vaccine. Now, what about pneumococcal conjugate vaccine 13 and 23? So remember, I've just told you before that 13 and 23 we cannot administer together. We have to give first if there is a high-risk patient. If there is a history of immunosuppression, you have to give 13 first, and 8 weeks later you can give 23. We can give 23 only in those patients who are in ages between, especially in between 19 to 64 years age. There you can give initially, or there may be certain conditions in which we can give this pneumococcal polysaccharide vaccine 23. But here it says the pneumococcal conjugate vaccine 13 and this PPSV23 should not be administered during the same visit for adults more than 65 years of age with an immunocompromising conditions. For example, in this case, the patient is having CLL, he's on chemotherapeutic agents. One of the two vaccines should be administered now and the other should be given at least 8 weeks apart. Now, pneumococcal polysaccharide vaccine 23. So are you going to give 23 alone at this point of time? So this PPSV23 offers protection against several subtypes, Streptococcus pneumoniae and related diseases. PPSV23 should be administered to healthy individuals more than 65 years of age. Healthy individuals. However, this patient has immunocompromising condition. This patient has CLL and this patient is on chemotherapy and first requires a different vaccination, that is PCV13. So you will give him PCV13 first before receiving this 23, and individuals whose ages are in between 19 to 64 of age, but they are having some problem, like they are having chronic heart and lung disease, they're having diabetes mellitus or alcohol use disorder, or having chronic liver disease, they should receive PPSV23 vaccination as well. So 19 to 64 years of age having these conditions and more than 65 years of age. But remember that if it's immunocompromised, you have to give 13 first and then later you can give 23. Now, what about influenza vaccine? Annual influenza vaccination is recommended for all persons more than 6 months of age and who do not have contraindications at the start of the flu season, which begins near the end of October in the Northern Hemisphere. And this patient visited in July, right? July. So there is no need for flu vaccination at this point of time. So what is the main educational objective of this question? That if you're just talking about in general, then the patient who are immunocompromised, who is having CLL, who is on chemotherapeutic agents, you have to give this pneumococcal vaccination, especially pneumococcal conjugate vaccine. You have to give PCV13. And first you need to inquire about the vaccination schedule, and if it's not given, then you have to give this PCV13, and 8 weeks apart you have to give PPSV23. So this is all about this. See you in next session. Bye bye.